we are very concerned about the psychosocial status of children. Right after the blast incident, we started providing a psychosocial support to hundreds of children. But now we estimate nearly 600,000 children may have been psychologically impacted. You talk about the 80,000 children displaced, but even children who are not directly in the damage of the building as such, everybody has gone through this unprecedented impact of the blast. We are very concerned what would be the consequences on the children's psychology. And at the same time, you may know that the COVID cases are very much at the uprights. So now we are preparing our children to be getting ready for the new school year, but it's really an additional burden for the people in Lebanon.
All right, tell us a little bit about some of the things that the children are displaying. What kind of behaviors, fears? We hear about flashbacks, nightmares. What else is affecting them, and what kind of behaviors might they display going forward?
You know, our staff, even in UNICEF, are not spared from this unfortunate crisis. I hear from colleagues, neighbors, and all children we contact with, younger children say, I do not want to die. Children also react to the sound. So this is a very sign of that psychological. But at the same time, we immediately started the support to those children. And this is definitely to continue. In parallel to that rehabilitation of schools and health facilities, our aim is not to disrupt essential services provision to people in Beirut and bring the normalcy of life to children as soon as possible.
All right, so UNICEF works all over the world, and you've worked in some trauma areas as well, even war-torn areas. What kind of help can children get? What kind of assistance are you providing them, apart from the basics, I guess, which is food, shelter, and that kind of thing?
Well, I'd said that the psychosocial support, together with, we call it the child protection support, we need to keep children safe. So to have a psychosocial status is important, but also the safe space. We cooperate with other agencies that children can be back to the safe housing, children can access to health services, and the school needs to be ready. So this is all areas, but also even access to clean water supplies. We have been repairing more than 60 buildings to have a clear water supply access after this blast, but also we placed more than 100 water tanks in Beirut. So this is a way to really bring people's life back to normal, especially for the protection of children.
What other things do you still need to do? I mean, what you're doing, I guess, is essentials straight away, but the whole rebuilding of Beirut probably needs to start taking place as well. What other things do you need to do as UNICEF?
Now we are focusing on the immediate response for the first 3 months period. This goes in parallel to the minor repairs to start with, particularly focusing on the basic social services, again, school, health facilities, but also some of the social work provision, including such psychosocial support together with the civil society community-based organizations. But at the same time, we also provide emergency cash by providing cash assistance directly to people who are affected by this blast. We want the people to have a normal life, at least at the minimum requirement. But then we need to take it up to the recovery plan, which is going to take months to rebuild this city of Beirut. Lebanon is a beautiful country, and Beirut is a beautiful city, but we are all committed, especially for children, to feel safe and they continue their life at a normal pace.
I would imagine that a lot of your efforts require help and assistance. Has that been forthcoming?
Indeed, as a UN, as a system, and the UNICEF is part of that, we are asking $46.7 million for UNICEF, particularly our assistance for children. Again, the priority areas of engagement is the psychosocial support to children to keep children safe, access to education and health and water, and emergency cash assistance. So these are the key priority areas we really need to get going to help children in Beirut.
All right. So I want to talk a little bit more about the children. And I would imagine, you know, we talk about the 181 that have died. Some may have lost parents. But there's also those that were maimed and injured. And children are exposed to this as well. This must be very difficult for them.
Very difficult. We know that out of 180 people, 4 were young children. Recently, we also know that the death of a teenager. And we are directly hearing that the sorrow and grief from those families directly impacted. And then more than 30 children are in the hospital. But as you know, that 6,500 people got injured. But the actual scar made on people are not on their physical injury, in their mind. When we talk about that actual scar in the people, in their mind, that goes to 600,000 children. And as you know, that the situation in Lebanon was already very, very difficult. The country was going through that unprecedented economic crisis to start with. And then this year, the country was even worsened by this COVID crisis. After 4th of August, after this blast crisis, COVID cases are also very exponentially increasing. In the springtime, we used to have 50 cases a day, but now we see that 500 cases a day, and more than 13,000 cases accumulatively in the country of Lebanon. So you see that the picture of Beirut, people are so desperate while the COVID virus is attacking them. So this multiple crisis in Beirut and Lebanon makes children's life very, very difficult and unsafe. So this is our mission. Again, we try all our best to bring children's life back to normal so children can learn safely, children can play safely. We provide safe spaces for children in the park. We provide the children to play with the books and the games. By doing so, I hope children find a way to bring their past. And another important matter, there are more than 1,000 young people volunteered to help the city cleaning, preparing for children. So this is a beautiful hope for Lebanon. So we think children and the young people are the hope for this country.